a comprehensive guide to low-level laser therapy and dentistry. Today, we're diving into the world of low-level laser therapy, also known as photobiomodulation, a cutting-edge tool that is transforming how we approach dental treatments. I'll be discussing its benefits, applications, and the science behind it. I have had many years of experience, both personally and professionally, on the uses of low-level laser therapy, and I'm excited to share this information with you. What is low-level laser therapy? A non-invasive light therapy that uses specific wavelengths of light to accelerate healing and reduce inflammation. It differs from surgical lasers in that there is no heat and no cutting of tissues. It is used in various medical fields like physical therapy, sports medicine, dermatology, and even veterinary medicine. How LLT works. The science behind it. Low-level laser therapy uses low-intensity lasers or light-emitting diodes, LEDs, to stimulate biological processes within the cells. The science behind low-level laser therapy focuses on how specific wavelengths of light interact with tissues to promote healing, reduce pain and inflammation, and stimulate cellular repair. Here's a breakdown of the scientific mechanisms. Light absorption by cells. The basis of LLLT lies in the fact that cells absorb light at certain wavelengths, typically the red or near-red infrared spectrum, 600 to 1100 nanometers. When tissues are exposed to light at these wavelengths, the mitochondria, the powerhouses of the cell, absorb light through the chromophores, specifically cytochrome C oxidase, which is a protein in the mitochondrial membrane. Enhanced cellular energy production. Once light is absorbed by the mitochondria, it leads to an increase in the production of adenosine triphosphate, also known as ATP, which is the primary energy currency of the cell. With more ATP available, cells have an increased energy supply to perform their normal functions, including cell repair, regeneration, and replication. This is one of the key mechanisms through which low-level laser therapy promotes faster healing and tissue regeneration, as well as enhances the body's natural repair processes. Reduction of oxidative stress. LLLT also helps reduce oxidative stress, which is a major factor in cellular damage and inflammation. When mitochondria function more efficiently, there is a reduction in the production of reactive oxygen species, ROS, which can damage cells if left unchecked. This reduction in oxidative stress contributes to a decrease in inflammation and pain in the treated area. Anti-inflammatory effects. One of the prominent effects of LLLT is its ability to modulate inflammation. The therapy has been shown to reduce the levels of pro-inflammatory cytokines and increase anti-inflammatory mediators. This means that LLLT can help mitigate inflammation in tissues, which is particularly useful for conditions such as arthritis, including the TMJs, the jaw joints, soft tissue injuries, muscle soreness, and tooth sensitivity. This anti-inflammatory effect also contributes to pain relief and enhances tissue healing. Stimulation of collagen production. LLLT promotes the production of collagen, which is an essential protein for the repair and regeneration of soft tissues, including skin, tendons, and ligaments. By stimulating collagen synthesis, LLLT helps in wound healing, reduces scar tissue, and improves the overall quality of healing in damaged tissues. Increased blood flow and angiogenesis. Another critical benefit of LLLT is the stimulation of angiogenesis, which is the formation of new blood vessels. This enhances the blood flow to damaged tissues, providing more oxygen and nutrients necessary for the healing process. Improved circulation also helps remove waste products and toxins from the affected area, further accelerating recovery. Pain modulation. LLLT has been found to modulate pain through several mechanisms. It affects the nerve cells by reducing the sensitivity of nociceptors, the sensory receptors that respond to pain stimuli. Additionally, LLLT promotes the release of endorphins, which is the body's natural painkillers, which helps it reduce discomfort and provide pain relief. Stimulation of stem cells. LLLT may also stimulate stem cell activity, which plays a crucial role in tissue repair and regeneration. The activation of stem cells can enhance the healing of wounds, tissues, and bones by promoting the growth of new healthy cells in the treated area. Scientific studies supporting LLLT. Several clinical and preclinical studies have demonstrated the efficacy of LLLT in treating a range of conditions, including chronic pain, such as back pain, arthritis, and fibromyalgia. Soft tissue injuries, including muscle strains, sprains, and tendinitis. Wound healing, particularly for diabetic ulcers, burns, and post-surgical wounds, including tooth extractions. These studies have shown that LLLT is a safe and effective therapy with few to no side effects when applied correctly. Applications in dentistry. In dentistry, LLLT is commonly used for reducing postoperative pain and swelling after extractions or implants, accelerating the healing of soft tissues after surgical procedures. If nerves were traumatized during a surgical procedure, resulting in pain and or numbness, LLLT can help those nerves heal and regenerate. Reducing inflammation on and treating TMJ disorders. Managing sensitivity and pain related to restorative work, especially when conservatively treating teeth with deep cavities. Teeth having living tissues in the pulp can experience sensitivity and inflammation, even though it may not be pathologic, and LLLT can help calm these teeth down and stimulate rejuvenation of the pulp. It can help reduce the pain of cold sores and or fever blisters and help them heal more quickly. Stimulating bone regeneration in cases of bone loss or dental implants. In conclusion, the science behind low-level laser therapy highlights its potential as a versatile treatment for various conditions. By improving cellular energy production, reducing inflammation, and promoting healing, and offering pain relief, LLLT is becoming an increasingly popular therapeutic tool in both medical and dental fields. Its non-invasive nature, in the absence of significant side effects, makes it a valuable option for patients seeking holistic, minimally invasive treatment approach. Home use of low-level laser devices. Low-level laser works best with multiple applications. At-home devices work like in-office devices, so it's beneficial to get an at-home device so you can use it as needed. Aim the light at the affected area for 2 to 3 minutes, 2 to 3 times a day. Move the lip aside and point the curved tip at the tooth or extraction site from the cheek side and the tongue side. For sore jaw muscles or jaw joints, remove the curved tip and point the wide beam at the area. You can also point the wide beam on the outside adjacent to a tooth extraction. Scientific support and research. Many key studies validate the efficacy of low-level laser therapy. Here are 2 comprehensive studies. Biologic response of stem cells to photobiomodulation therapy and photobiomodulation, underlying mechanisms and clinical applications. They can be seen on holisticdentallearning.com in the low-level laser tab. Here is a success story. This tooth had cracks, had an old silver mercury filling and a cavity, and was sensitive to temperature and biting, and 2 other dentists said it needed a root canal and a crown ASAP or else. The tooth was successfully and conservatively treated with a direct bonded composite restoration, which included ozone disinfection, low-level laser treatment, and a calcium liner. The patient diligently followed the home care regimen for optimal tooth and gum health before and after the treatment, low-level laser being a very important part of that regimen. You can see it in the Daily Regimen tab on the website. The patient and the tooth are very happy. In conclusion, low-level laser therapy is a safe, effective, and non-invasive way to improve oral health, reduce pain, and speed up healing in dentistry. As an aside, from the typical use of low-level laser therapy, there is also a scientific article on how LLLT can help you stop smoking by aiming the light at acupressure points on the ear. I encourage viewers to consider LLLT as a part of their holistic dental care routine. For more information on LLLT, see at-home products, and how it can benefit your oral health, visit holisticdentallearning.com.